Hello, I am Dr. Ramayajit Lahiri, consultant and in charge of Emergency Medicine Department, Narayana Superspeciality Hospital. I am basically emergency medicine physician. Here we commonly deal with all kind of emergencies, day in and day out. Now, today I am going to talk about mainly trauma. Trauma means, say, a fall can be a trauma or a road traffic accident can be a trauma. Wherever you get an injury, it is actually a trauma. It can happen during a play, it can happen during your bicycle ride or a bike ride, or once you are riding or driving a four-wheeler. Now, the main point what I want to highlight in trauma is, whenever there is a trauma or say a road traffic accident, the commonest mistake what people do is we always try to keep the patient awake and we try to put some water into the patient's mouth. First thing, that is very wrong. We need to assess whether the patient is actually conscious, whether the patient can actually swallow. Otherwise, the main problem what we do in this act is that water, instead of going into stomach, it goes into our lung and causes aspiration pneumonia. So instead of helping, we might actually causing more harm to the patient. First mistake. Now the second mistake we commonly do in roadside emergencies, whenever there is an impact or an injury, we generally lift that patient by holding, two people, someone is holding hand and someone is holding the leg. So what happens, the patient basically hangs. In this mode, what happens, the spine becomes, it get curved, and if because of that injury there is some problem in the spine or any fracture in the spine has happened, then that can get aggravated, which can cause a paralysis, and that patient might suffer a lifelong trauma. So be very careful. Let the patient lie down properly. There only what you do is you secure the area, you secure that zone, you prevent any vehicle or anyone coming near that scenario, you make that area cordon, you assess whether he or she can reply your command properly, a proper conscious level is there or not. If he or she is asking for water, then you can provide, but be very careful and always give in a very minimal quantity. Second, take care of the spine. That is one thing we commonly neglect. So take care of the spine injury. Then third thing, don't do anything heroic. Please call the nearby police or a nearby ambulance service available or the nearby hospital available, so that the patient can reach the emergency medicine department as early as possible and some specialist can take care of that patient. Thank you.